I don't need to call up an old friend, 'cause all I need is what's in front of me. And I don't need nobody's company. Gonna drink till I can't see what's happening to me. I'm gonna drink till it comes clear what I'm doing here while I keep on working, keep on working. Gonna sit down at this bar while I keep on working. Yeah, keep on working, keep on working. Gonna sit down at this bar while I keep on working.
driving so slow, just one foot in front of the other, with no direction, no. There's all alone, free falling in the day. Don't wanna hear a word you say. Yeah, he just keeps falling, 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 falling till the light fades away. Man, in these beds got X-ray vision, sees into the future, but everybody lets him down. And in his own head, a world of confusion, with nobody else around. Yeah, man, he thinks he's on such a roll, just before it swallows him whole. Yeah, he just keeps falling, 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 falling down. It goes, and it tries to climb way back up, only to find that it's out of luck. Oh man, but it don't give up, because he's so blind in loving the abyss. Yeah, man, he thinks he's on such a roll, just before it swallows him whole. Yeah, he just keeps falling, 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 falling down. He goes, down. He goes, down. He goes,
I'm giving up on your love. I'm giving up on ever being good enough. Hope springs eternal in the heart of a child. But I grew up and I'm giving up. On the outside, pretty picture painted by Norman Rockwell, but inside it was something else. At times it was a living hell, 'cause your love's like water. It steams and it freezes, it quenches and it drowns, it evaporates without us. I'm giving up on your love. I'm giving up on ever being good enough. Hope springs eternal.
2021 at 9:06 a.m. and we're meeting here at 700 Lavaco with me and Commissioner Howard, and we have Commissioner Gomez, Commissioner Shea, and Commissioner Trevelyan with us remotely. I will hand this off to Mayor Adler to call the Austin City Council to order. And while we're doing that, I will also say that we're going to meet jointly with the Austin City Council again today, and we are going to first have an update from Dr. Escott and Director Hayden Howard, combined briefing to make great use of their time and our time and your time. And then we'll go through questions just like we do every week, try to hold it to one question. We'll have the commissioners go first, and then the county judge, and then the council members, and then the mayor. And I think we are just holding a minute for Mayor Adler.
County Judge, I understand that the mayor and the mayor pro tem are running late, and they've asked me to gavel us in at the appropriate time.
Oh, that's wonderful. Thank you. So I will pass it over to you, Councilmember Alter.
Thank you. Good morning. My name is Allison Alter, and it is 9:08, and I will convene the Austin City Council meeting this morning, April 13th.
Thank you. Okay, so let's go ahead, Dr. Escott and Director Hayden Howard. If y'all, oh, we also have City Manager Spencer Cronk with us today. But go ahead, Dr. Escott, for your update if you're ready. Oh, I'm sorry. I take that back. I'm all off today. Can we see if we have any callers today?
We do, Judge Brown. This is Larry. Yeah, this is Larry Schooler. We do have, I believe, 4 or 5 callers. Whenever you're ready, we are ready.
Hot dog. Okay, let's do go through the callers.
Caller in 3536.
Stand by. Stand by. Sorry, our screener was screening yet one more caller, but nevertheless, we're ready when you are, Judge.
I am ready.
Okay. Stand by. So we should have Hamid. Let's see. Make sure I say this right.
Hello, caller.
Hamid Hajafar.
36.
Oh, stand by. Casey, I think you're trying to screen, and we're trying to take a caller live in the meeting. So, Casey, please stand by. And we're going to go to Hamid Hajafar. Hamid? Hamid, are you there?
Mute.
Hamid, you have the Hamid, you have the floor. Please speak.
Hello.
Hello. You can go ahead.
Hamid, you're live in the meeting.
Hello. Can you hear me?
Yes, we can hear you just fine.
Okay, can I talk to?
You have the floor to speak, sir, on COVID, if you'd like.
Oh, no, sorry. It was item number 7 that I wanted to speak.
Sir, I'm gonna place you on hold and come back to you here in just a minute. Let me go to Susan Woody. Susan, if you're there, you have the floor.
Hi, thank you. Hi, everyone. My name is Susanna Ledesma Woody. I'm calling to ask what Travis County and the City of Austin are doing together in a joint effort to vaccinate marginalized communities. So far, efforts on both sides have continued to be disproportionately distributing the vaccine to our communities. So, I'm asking what you've done, or I'm saying what you've done in the past and what you're currently doing isn't working. So I'm asking what and when are you going to actually start working in joint efforts to help vaccinate our communities? Thank you.
Our next caller on this item is Sarah Black. Sarah?
Yes, hi. Good morning. I'm part of that marginalized community, and I just want to speak on item 2 about necessary measures and actions related to COVID-19. I live in Travis County Precinct 4 and City Council District 3. I'm a Black female who's lost everything due to, this system here in Austin, Travis County. I just want to say that Central Health tried to charge me $10 for my March vaccine appointment. So a couple of days before my appointment, I was asked to check in for my appointment at Central Health subsidiary Lone Star Circle of Care. When I started going through those screens, it showed that there was no copay for my MAP. I'm on the MAP. I have a MAP card with Central Health. Showed there was no copay for MAP, but the next screen said I had to pay $10. And did I want to pay cash? Did I want to pay credit card or cash at the screen or something like that? I sent a copy to Margaret Gomez, of the screen showing them trying to charge me $10, and also of the doctor they put me with. There was no Dr. Otto ZZZ. It said, Dr. Otto ZZZ, do not use, but that's the doctor they used to try to charge me $10 for my vaccine. I didn't pay it. I contacted them and said, there's no charge for the vaccine. I don't know if other people in my community are being asked to pay $10 to get the free vaccine, and that's could be a reason why they're not getting it. Previously, in your same MAP program, I was denied MAP for several months in 2020, from May through November. I was told I needed to provide my birth certificate. It's just like a poll tax. So that was my 3 times based on these bogus reasons, this little higher standard for me, not who else has to provide their birth certificate. But anyway, so finally, a guy named Dante Hernandez, he changed my address to some sort of intersection, even though I had an address on my driver's license, which was my address. And he changed my mailing address to the Salvation Army. And so my understanding is Salvation Army got some sort of cut from Dante Hernandez putting that false address for my application. And then at that time I was approved, and they didn't need my birth certificate because Dante Hernandez says they already had my information. So, and I complained to Stephanie Hayden, also public health, about them trying to charge me $10.
Judge has 3 minutes.
2 ways they made money.
Thank you.
Yeah,
Thank you,
2 ways they made money on my MAP application. Thank you. Bye.
Thank you very much. So it sounds like you were saying that it sounded like someone was charging for a vaccine, which just should not be the case and is not the case. And so I'll make sure we follow up with Central Health and others to make sure that that's not being miscommunicated somehow. Thank you for your call. Larry?
Judge, we have Kara Bell standing by. Kara?
Yes, hi. Thank you so much for taking my call. I wanted to follow up regarding the situation of Dr. Mark Escott continuing to claim that masks stop the spread of virus. I asked him multiple times in the last 6 months to show me the science that masks stop the spread of virus. He has been unable to do so at every time. I wanted to let you know that I received on April 5th a response to my FOIA request to the CDC asking for their science that masks stop the spread of virus, because this is the science that Dr. Mark Escott quoted to me in a response to an email of mine. He said the CDC is the proof. The CDC wrote in a letter to me, it says, for item 2 of your request, the subject matter experts provided the following information and links. CDC is not aware of any randomized controlled trials that show that masks or double masks or cloth-based coverings are effective against COVID-19. If the CDC does not have a randomized controlled trial, which is the gold standard of evidence, as Dr. Mark Escott knows, then there is no science proving that masks stop the spread of virus. This is proof that Dr. Mark Escott was wrong again, just like he was wrong in July when he said that 40 to 1,300 children may die if schools open. Dr. Escott continues to be wrong, and you are trying to take away, and you have been taking away our rights based on fraudulent opinions from Dr. Mark Escott. I have provided him the science, the information, and he continues to double down and falsely claim that our numbers are rising when they are not. Our numbers are going down. We are doing very good as a county and as a state. This is complete tyranny. And Judge Andy Brown, you illegally muted me on January 26th. What is the county doing to protect its citizens? You illegally muted me on January 26th. You illegally muted another caller on January 12th. This is complete abuse of power, and I want to know what Travis County is doing to protect its citizens against criminals like you and Dr. Mark Escott?
Judge, we do have one additional caller on the line, and we didn't have a chance to screen before we took calls. This is a call ending in 3536. Caller, if you're there and it's COVID related, you have 3 minutes. Hello, caller. Judge, that should conclude our live callers at this time for COVID.
Judge, if I may just note that we have some council members are on multiple screens. We are at 6 now, 6+ now. We have myself, Councilmember Tovo, Councilmember Kitchen, Councilmember Ellis, Councilmember Poole, Mayor Adler just joined us, and Councilmember Kassar was also on the line. I'm not sure that everyone was there earlier when we called the meeting to order, so I just wanted to make sure that we noted that for the record, that we now definitely have a quorum. Thank you.
I think that Councilmember Renteria is also on, I think, and I see the Mayor Pro Tem now too.
Okay, great. Thank you.
Yeah, I see Mayor Pro Tem. Oh, there. Yep, see all those folks. Thank y'all. Thank you very much. Okay, so Dr. Escott, are you ready to give your report?
Yes, Judge, I will pull up my screen and share that with y'all. Okay, can you see that? Okay. First, I want to make a couple of comments. One of the callers talked about how well we're doing in Texas, how well we're doing in the United States. We've got more than 48,000 Texans who have died so far from COVID-19, more than 550,000 Americans. I don't think that's success. I think we have to continue the effort to mitigate the risk of the spread of disease, hospitalizations, and death, and we've got a long way to go. And masking has certainly been shown to be helpful in that. And we have to remember the science. There's different levels of science. Randomized controlled trials is one level of scientific study. Obviously, in the middle of a pandemic, it would be unethical to run a randomized controlled trial determining whether or not somebody gets a potentially infectious and deadly disease. So the lack of a randomized controlled trial does not equal lack of science supporting, and I want that to be very clear. First, Judge and Mayor, I want to talk about the update this morning from the FDA regarding Johnson & Johnson vaccines. So far in the United States, about 7 million individuals have been vaccinated with the Johnson & Johnson vaccine. The FDA has identified 6 cases of something called central venous sinus thrombosis, particularly in females aged 18 to 48. So this is a result of clotting. It's kind of an unusual thrombotic event that happens in the head, in the brain. So they've got to work out some more details on the potential causes of this in addition to the vaccine. This is a rare condition, but there are lots of risk factors, including genetic abnormalities that can promote clotting, sickle cell disease, oral contraceptives, things as simple as dehydration. All those things can contribute to the development of clots. So what the FDA needs to do is to look in more detail in these cases to determine whether or not the vaccine may have been a contributing factor. So that's why they put the pause. They're going to meet on Wednesday to review some of this data, and we expect to see some recommendations that may be in the form of warnings for specific individuals, or there may be other recommendations. But until that point, Austin Public Health has paused the administration of Johnson & Johnson vaccines pending the review from the FDA. Importantly, individuals who have a severe headache, abdominal pain, shortness of breath, or pain or significant swelling in their legs or a leg within 3 weeks following the vaccination should contact their healthcare provider immediately. If they don't have a healthcare provider, they should go to the emergency room or urgent care center for evaluation. So again, we are pausing the Johnson & Johnson vaccine administration until we have further recommendations from the FDA. Again, luckily, the majority of vaccine that Austin Public Health receives and administers is Moderna. So we have a very small number of doses that we've given of Johnson & Johnson and that we have of Johnson & Johnson. So we will provide updates on that later in the week as more information comes out from the FDA. I also want to talk about some controversial comments regarding how far we are towards herd immunity. And I want to clarify and provide some data to explain the situation a bit more clearly. So when we look at the two green areas in this pie chart, the dark green is the individuals in Travis County who are fully vaccinated. That's about 22% of our overall population. 14%, an additional 14% have been partially vaccinated, so they've received one dose out of a 2-dose series. So about 36% of the entire community has been vaccinated. So that's the vaccine-acquired immunity that's either there or in the process of being there in terms of the individuals who received a partial vaccination series. In addition to that, in the yellow box, you see that about 6% of the Travis County population has been identified as a confirmed case of COVID-19. Additionally, based upon estimations from the UT Modeling Consortium from Dr. Lauren Myers and her group, there's an estimated about 3 times total that number of actual cases that are likely to have happened in Travis County that weren't reported. So a total of 18% possible of the Travis County population had COVID-19 and may have some immunity from that. Again, this pie chart is showing an assumption that there is zero overlap between people who had COVID and people who've been vaccinated for COVID, which is obviously not the case. So this is going to overestimate the protection that we have in terms of progress towards herd immunity. But the governor's right. Herd immunity does involve both immunity from natural disease as well as immunity from vaccine. So it is a combination of that. We will say that the data right now supports that the vaccine provides a more comprehensive immune response than the disease itself. So right now it appears that the vaccine is more effective at preventing subsequent disease than having the history of disease. So we still want everybody to get vaccinated, even if they had COVID. Having said that, the best case scenario right now is that we have about 54% of people who've either had the disease or are fully or partially vaccinated right now, which means 46% of our population, almost 600,000 people are still vulnerable to COVID-19. So in short, we've got a long way to go in terms of herd immunity. We are making good progress, and I'll talk a little bit later about some of the specific areas we're making substantial progress, as will Director Hayden Howard. This slide is an update of our new confirmed cases in Travis County. Yesterday we reported 107 new cases, which gives us moving average of 130. That's a 30% increase in the moving average of cases since last week when we gave this report. So we are seeing an increase in that moving average of cases. We had been very flat for a while, but we are seeing that uptick right now. Again, we'll continue to watch this. Yesterday was a little lower than the day before, so it's starting to come back down a little bit. But again, we're still in that post-spring break, post-Easter time frame where we are expecting to see increases in cases. It appears that is happening. When we look at the new admissions to the hospital, however, we're still in that oscillation. Yesterday we reported 18 admissions. We have a moving average of 18. And we've been oscillating in that tight range of 16 to 20 on the moving average of new admissions for 18 days now. So again, this is something else that we expected as the vaccination rate increases in those who are at higher risk for hospitalization, we can have increases in cases without increases in hospitalizations right away. So again, this is part of what we expected to see. We'll continue to follow all these numbers also, but certainly a more recent increase in cases makes us concerned that we may see an uptick in the admissions as well. This is an update of the hospital data. So the blue is the hospital beds being utilized, the orange is ICU admissions, the gray is ventilator use. Hospitalizations yesterday were 134 with a moving average of 134. That's a decrease of 4% over the past week. ICUs were at 41 with a moving average of 45, a 13% decrease in the past week. And ventilator use was 20 with a moving average of 21, a decrease of 23% in the last week. So again, the hospitalizations, the ventilator use, the ICUs, still on a slow downward trend, which we're happy to see. This is an update of the projections from the UT Modeling Consortium. Again, you see things relatively flat with a slow decline in terms of admissions to the hospital. I'm happy to say that stage 2 territory is now back on the projections, but it's way out on May the 9th, Mother's Day. So again, if we continue those protections, continue the masking, distancing, the hand hygiene, staying home or sick, getting tested when we have symptoms, it's going to help contribute to this, as will our ongoing vaccination efforts. This is an update of our hospitalizations by age group. We have seen a little movement in terms of the percentage of admissions to the hospital with our 70 to 79 age group going up this week, as well as our 50 to 59 age group. Some significant decreases, though, in our 20 to 29 age group as well. And we see our 80 plus age group still at a much lower percentage than we have historically seen during this pandemic. We look at the breakdown of hospitalizations by week. You can see that we had about a 6% decrease in the total number of individuals hospitalized last week as compared to the previous week. You can see that there's not really much change in most of these numbers week over week. Tiny increase in our 80 plus age group, increase of 5 in our 60 to 70 to 79 age group, and you see a significant drop from 21 to 12 in our 20 to 29 age group. Otherwise, relatively flat in terms of the hospitalizations within the age groups week over week. Similarly, relatively flat in terms of the hospitalizations by race and ethnicity. In particular, our communities of color are relatively unchanged as compared to last week. Again, as one of the callers pointed out, we're still very concerned about the disproportionate impact on our communities of color, and Director Hayden Howard will be talking more later about how we are reaching out to those communities in terms of the vaccination effort. This is those hospitalizations with the numbers of individuals hospitalized by race and ethnicity. Again, not much change, almost exactly the same for each of the race and ethnicity categories as compared to last week. This is an update of our positivity in Travis County by week. Again, you can see for the past 6 weeks, not much change. We have seen a small increase over the past 2 weeks, going from 4.3% to 4.5% and 4.8% last week. We're still maintaining underneath that 5%. I will say that we have seen testing drop off significantly. So we do want to encourage folks, if they have any symptoms which may be consistent with COVID-19, congestion, sore throat, change of smell or taste, nausea, vomiting, diarrhea, cough, shortness of breath, any of those symptoms, they should get tested for COVID-19. They should isolate themselves until they get those results. The more we can test, the more we can identify people who have it, the better we can isolate, quarantine people, and end the spread in Travis County. When we look at the positivity by race and ethnicity, again, there's some good news here. We see that almost all the race and ethnicities are at or below that 5% threshold. Our Latinx community went from 7.1% to 5.8% last week. African American community, 5.3% to 5.2% last week. Our Asian American community has risen from 2.2% to 5.4%, and our white non-Hispanic community, 3.8% to 3.9%. So again, relative consistency across our races and ethnicities for the first time in my recollection during this pandemic. So again, I think this is a testament to the vaccination efforts, as well as the efforts to get people tested, to isolate, to decrease transmission. When we look at the positivity across the age categories, our older age groups, our 50 and up age groups are all at or below 5%, with our 70, 79, and 80 plus age groups under 3%. So that's fantastic. And again, when we look back on the history of our vaccination effort, we really focused on our long-term care facilities. We focused on our older individuals in our community, and it's certainly paying off in terms of disease transmission there. We are, however, seeing increases in our 10 to 19 age group, our 20 to 29 age group, and our 40 to 49 age groups. So again, COVID is still out there. It's still spreading. It still has the ability to create a surge. Because of the effective vaccination of individuals 65 and older, it's going to be less impactful on our hospital systems if we have a surge. But we can still surge, and it's important for all these age groups to continue to follow those precautions to avoid transmission and avoid those unnecessary hospitalizations and deaths. When we break down the positivity in our school-age children, again, we see the pattern continue. Our high school and middle schoolers are well above the community average, 6.2% and 7.3% respectively. Our elementary school and preschools are below 2.5% and 2.3%. So again, throughout the rest of this semester, and for a significant portion of this summer at least, our school children are going to remain at higher risk than the rest of the community because of the lack of vaccine availability. So when we're thinking about the rest of the school year, when we're thinking about summer school, summer camps, and even the beginning of the school year, we're going to have to continue those protections to mitigate the spread in young people, or we will see a surge like other countries have in young people. We will see increased hospitalizations. We will see increased deaths. This is a report from our schools task force for last week. Again, a total of 82 cases in schools, a significant decrease from what we were seeing in the fall and in the winter months. 68 student cases, 14 staff cases. You can see that AISD and Pflugerville have had some clusters of cases. We have seen clusters associated with sports teams, as we've seen throughout this year. We have one cluster involving a sports team with 13 cases and involved a bus trip to an away game. And significant for about 50% of the student athletes on that bus have contracted COVID-19. So again, we have to maintain those precautions. We have to maintain the distancing and masking, particularly on shared transportation, around meals, to avoid this kind of transmission in the future. When we look at the impact on individuals quarantined, 635 students quarantined, 87 staff. Again, a significant decrease from what we're seeing in the fall, but still impactful in terms of our school students and our school staff. Again, great news in terms of our long-term care facilities this week. 6 cases in the last 14 days, 12 in the past 28 days. Again, 98% decrease from what we were seeing back in January and early February. This is a testament to effective vaccinations and how well it works. And I encourage folks to go on to this dashboard off the APH website and scroll down that left column and see that the vast majority of long-term care facilities have 0 cases. The ones that do generally have 1 case. We have one facility in our entire community that has more than 1 case in the past 14 days. And this is what herd immunity looks like. You may have one-off cases, you may have a small cluster, but the more it meets with vaccinated people, the higher the chance of sustaining or not having a sustained spread. So you have isolated pockets, you have small numbers, you don't have sustained and a growing epidemic. And that's what we need to do here. But we still have, we're about halfway there, maybe halfway there. We still have a ways to go, and that's going to take all of us continue to work to get vaccine out and encouraging folks to get the vaccine that's effective and safe. An update on our regional infusion center. Again, TDEM worked with us to open this, and we're certainly grateful to the state for their contributions to this effort. 969 individuals so far treated with monoclonal antibodies. And again, these are individuals who are high risk for hospitalization and death from COVID-19. So, I think this is, certainly impacting our hospitals, our ICU numbers, our ventilator use by having almost 1,000 people in our community treated with these monoclonal antibodies. Our capacity still exceeds our demand, so we encourage folks to have that discussion with their healthcare provider. If they are high risk, if they're older, if they have underlying health conditions, talk to your healthcare provider about getting this monoclonal antibody therapy. It can certainly save you a hospitalization and save a life. Quick updates on our influenza situation. 0 cases for week 13, which is fantastic. 1.17% overall. Just over 100 cases to date in the entire county for flu this year. Again, this is a combination of vaccination effort, masking, distancing, all those protective measures for COVID-19 are certainly translating well for influenza, so we're grateful to see that. This is what it looks like compared to other seasons. Again, record low season here in Travis County, and certainly gives some indications of how we can manage flu season in the future if we have unusually bad years. We can effectively mitigate the spread and save lives there also. Again, as a reminder, we remain in stage 3. We need to transition below that 10 on the moving average of new admissions to the hospital in order to move to stage 2. If we continue those efforts, we will get there hopefully in the beginning of May. Excuse me. I want to mention one other thing. I have revised and renewed the health authority rules to be effective through May the 18th. There's been a few modifications among them. This allows exposed individuals who are fully vaccinated to avoid quarantine if they are asymptomatic. It also allows removal of masks in limited situations that CDC has outlined in their guidance. It also transitions the minimum distance between students from 6 feet to 3 feet, with the exception of stage 5 where it goes back to 6 feet. So again, we're pleased that we can continue these protections for our community. We'll need to continue them through at least the middle of May, and then reassess the situation and see if we can modify them further. Our hope is that as the situation improves, certainly if we transition into stage 2, that we can continue to modify these to make them less burdensome for people so that we can start to inch back towards normal. But we're not there yet. We've got to stay the course, at least the middle of May, probably the end of May, so that we can put ourselves in a better situation to control this disease and continue to save lives. With that, I will turn it over to Director Hayden Howard.
Thank you, Dr. Escott. This is a snapshot from our vaccine dashboard, and we're really excited that we have added the Circuit of America data site to this as of today. We have provided 285,697 vaccines in our community. One of the things that you will notice if you go to the page, you will notice that with the data, 13% of the Asian community in Travis County has received their vaccines. Black African Americans, 7%. Hispanic is 25%. And so as we continue to just work through to make sure we're getting all of that data over time, you'll see the changes that are represented in the data. Still have a little bit more work to go for the map on this page. And so we'll continue to work on that, but you will be able to access the map. We are adding some additional information just to kind of make it be a little clearer and cleaner. In comparison with the data that the state is showing, we have, we've kind of looked at it from a comparison perspective. As you know, state data is a little lag. And so in comparison with the data we have, we're at 13%. The state of Texas website shows for Asians 7.1%. For African Americans, it shows 3.32%. And for Hispanic population, it shows 17.05. And so as we've moved and are showing the data, this does give us a little bit more of an accurate account. I will say, though, this does not include all of the other providers in Travis County, but, really excited that we have added the information of what's happening at the county site in COTA. Next slide. What we have going to focus on for the next couple of slides, we wanted to share this dashboard. Now, this dashboard does not have the data that I just showed. That was combined data. That was data as of 4/10. This is data as of 4/3. And so just kind of taking a snapshot of, during this time, laying out this data. And as you can see from the map, there are areas where we're seeing a greater concentration. What we have noticed as being a hub is that Austin Public Health has provided more vaccines to folks that are living in the Travis County / Williamson County area in the 78660 community. But however, we have provided over about 57% or more to Travis County residents. Next slide. As Dr. Escott was talking with you about vaccine herd immunity, in our report that we produced earlier this month, the goal is to have 67% of vaccine-induced herd immunity. That would be 800,000 people. And so when we look at just a snapshot from week 17, basically during that week, 49,500 folks were able to receive their vaccine. And so as you can see on the right side, we're roughly about 49% based upon the folks that have received at least 1 or 2 of their doses. This information has changed. As of today, we are, according to Travis County data, we're at 447,152 for first doses and 273,249 for the second doses. So as you can see, still a little bit of an increase based upon week 17. Next slide. We thought we would just kind of take a snapshot of, what is happening worldwide. It's always important because as things begin to open up and folks begin to travel, this is looking at 100 people within a given population, looking at a single dose. And so, from the information that we receive, we are aware that about 20% of people in the United States have received their vaccine. But as you can tell, we definitely all have a long way to go. But this just gives you, from Oxford University, just a snapshot of where we are in comparison worldwide. Next slide. This is an update for our vaccine for childcare, education, and our senior population. We're at 12,520 for school and childcare staff that have been received at least 1 dose of the vaccine. With our seniors 60 years of age and older, 57,000, and second dose is greater than 38,000. According to the Texas Department of State Health Services, 75,000 residents that are 65 years of age and older have received their vaccine. Next slide. As you are aware, as of Monday, we made a change and opened up our portal to individuals that are 18 years of older can now schedule an appointment with us. And so one of the things that we are continuing to do this weekend, we will be at Sacred Heart on Friday and Saturday in partnership there to provide a vaccine clinic. We are still working with Family Elder Care to provide vaccines at their locations. We have transitioned with the Housing Authority, with the city, also with the county to be able to provide some vaccines in the community at those sites. And we are working with Mobile Loaves and Fishes to be able to go out and provide those vaccines. Our year-to-date team that's been out and about, they have provided over 2,000 vaccines to folks. And some of the things that we have transitioned to is we have moved from the Dove Springs Recreation Center, and we are now at the Southeast Branch Library and providing vaccines there. And that particular site is focusing on folks that live in the 4-5 community and neighboring communities. So when our partners refer folks that live in those communities, we are scheduling them for there. In addition to that, we do have a partner that is going door to door, getting some information for us. And so we will be scheduling them at the Southeast Branch Library as well. And so our equity team is continuing to make those outbound calls to get individuals scheduled. This Thursday coming up, our team is going to be at one of the AISD sites on Thursdays, they provide food assistance. And so our staff are going to be working with the parent support specialist and basically kind of looking at the process that they have set up. And at those locations, they are providing food every Thursday. And they reach thousands of people at several locations throughout the Eastern Crescent. And so our staff are going to be working with them to put a process in place where we can provide vaccines in collaboration with them. In addition, we are also looking at some apartment complex where we're able to use the community rooms there. And so we have been working with some key informant partners that have provided us names of apartment complexes that we are going to transition and start going to provide those vaccines. And so as we continue, the example from last night is that we released 14,000 vaccines and we only filled about 3,400 of them. And so as we really need to start to pivot, really start to look at expanding the footprint of these models of where we're going to apartments and working with the parent support specialists and working in smaller locations, partnering with sites that may have an event going, kind of similar to what we've done in the past, where our staff were out doing flu vaccines, for example, at a community event. And so those are some of the things that we're going to start to pivot to do as we start to shift over into the month of May. In conversations with some of my colleagues across the state of Texas, a lot of us are getting to a point where we know we're going to have to pivot and change strategies, because now we're at a point where there is more vaccine that's readily available in our community. And so we must be strategic and start to make those changes. Lastly, our partners, UT Del Med, Travis County, UT Nursing School, Community Care, and Central Health will start having meetings on Friday at noon. And so the purpose of those meetings is to identify gaps in our community as we're looking at the Eastern Crescent, where we are able to provide vaccines in areas and make it more easier for folks to receive those vaccines. Working together collaboratively is definitely the best approach. So in the meantime, we have asked folks not to stop what you're doing, continue to do the work that you're doing, but we definitely want to be able to create a map that will show how we will be able to move around as partners, including Austin Public Health. That completes my presentation, and I am available for questions. Thank you.
Thank you, Director Howard. I'll give a short update on some of the smaller efforts on the Travis County side. So we're doing second shots. We did second shots again at Circuit of the Americas this past weekend. We also did a collaboration with Del Valley ISD and ACC, where actually the students who are in sort of a combined program with Del Valley and with ACC, a vocational program to an allied health program, actually came up to Circuit of the Americas on Friday, Saturday, Sunday, and mixed the Pfizer vaccines along with Toby and the Ascension team and folks from ESD 11. And also at the same time on this weekend, he set up, I think, 1,100 appointments with ESD 11 and Del Valley ISD, Commissioner Gomez and others, to give out those vaccines actually at Del Valley High School in a partnership with them, where those same students were helping with that. I think that was about 1,100 doses. Manor, which did 1,100 the previous weekend, I believe is going to do another clinic this weekend. And then we're working with some private providers to try to add one additional clinic in eastern Travis County as well. Also working on a plan to do visits to apartment complexes with a team made up of probably folks from ESD 11, the constable's office, and others, kind of going apartment complex by apartment complex. But the overall goal with what we're seeing is the way to increase sort of the equity, increase the numbers of Latinos and African Americans receiving vaccines, is to reduce the barriers of having to log in ahead of time and instead have clinics where you can either walk up or where the clinics come to you. Know that obviously Director Hayden is working hard on that as well, so I'm glad that we're heading in that direction. With that, I'll pass it over to Commissioner Gomez to see if you have any questions for Dr. Escott or Director Hayden.
Well, I think that the reports, I appreciate the reports. They're promising. At least I feel like we're going to make some more progress. We are also going back to the database that we established with the census effort that we made earlier, and with the constable's office. Certainly in Precinct 4, the constable and the JP were brought together to make a real good effort on the census. And that is going to be the database from which we are working on to make sure that we contact more people. Those who will not come forward, we can at least go to them. And I think that's what the effort is that is going forward now. That should provide us a good group of people that we can contact to make sure that they get vaccinated. The PPE effort, and it was very good, I think, and we put resources into that effort, but it's time to transition from PPE to vaccinations. And so that's going to, I think, hopefully get us to our goal. I've told folks that the goal here is herd immunity and to make that transition. So we hope that will get us to our final goal. But thanks to everybody. Sounds like everybody's working very hard at trying to get people to get vaccinated, and so many thanks to all of them.
Thank you, Commissioner Gomez. Commissioner Shea?
Judge, and my usual thanks to Dr. Escott and Director Hayden Howard and all of the staff and all the volunteers that are working incredibly hard to try and get the vaccines out and help with all kinds of issues related to the pandemic in the community. I had two questions. One was on the any further information related to the reinfection rate and the duration of the vaccine effectiveness. And then the other one has to do with opening up the vaccines to young people. I think there's been an impression that young people are less vulnerable, less likely to get it, et cetera. How urgent is it that young people be encouraged to get the vaccine as soon as they can? And I also don't have a sense for how many vaccines are coming into the community and how easily accessible it will be for younger people now that they're able to sign up for the vaccines.
Well, Commissioner, I think, if you qualify, you should get it as soon as you can. Again, when we talk about statistics, yes, younger people are less likely to have severe disease. They're a lot less likely to die, but those chances are larger than zero. And those chances are much higher than the risks associated with the vaccine, even with the concern the FDA raised today regarding Johnson & Johnson. We're talking about 6 adverse events out of 7 million doses. It's a tiny, tiny number. So I'll tell you that my daughter's 17 and she's going to get her shot today of Pfizer. So the Pfizer is available for individuals 16 and older. The Johnson & Johnson and Moderna are available for 18 and older. If you're eligible, sign up and get it. I think the message from Director Hayden Howard that we have vaccine appointments left over should indicate, folks, that they don't have to wait. You schedule, you can get it this week. Get online, sign up. If it's not through APH or one of our partners, CVS, Walgreens, HEB, Target, Sam's Club, Walmart. Lots and lots of providers now have the vaccine. They're getting more vaccine. Get your shot. Regarding the duration of the efficacy, it's at least 6 months. We'll continue to assess that efficacy, but it's very protective. Are there cases of COVID-19 in people who have been vaccinated? Yes. The protection was never 100%. When we look at the cases in Travis County, last week that number was about 31 people who've been fully vaccinated and have been diagnosed with COVID. Again, even if you get it, the risk of severe disease drops, the risk of death drops. Those numbers drop to close to zero. It's going to be greater than zero, but it's close to zero. Even if you get it, even if you've had COVID before, even if you don't think you're going to get it, get the shot. Our hope is that people will hear that and will answer the call to get it. We also need members of our community to continue to advocate in their community groups, in their associations, their extracurricular groups, their social groups, to get the vaccine. Answer questions about hesitancy. Refer people to definitive sources regarding the vaccine if there's concerns brought up, so that we can get through this phase of vaccination and reach herd immunity.
Thank you. Commissioner Trevelyan.
Good morning. Once again, I would like to thank Dr. Escott and Director Hayden Howard on their willingness to do non-conventional things to reach out to the community. Once again, I just want to point out that a lot of the issues that we are working through are structural issues that have been with us for a long time. And I hope that very soon after we get to the other side of this, we really work and plan on addressing those areas that have structural problems and economic deficiencies, so that the next time we see something like this, we won't have the same problems over again. So thank you for what you've done. I want to document a lot of those things and make sure that we are aware, so that when it is appropriate, we can institutionalize some of those things. I've been looking at best practices around the country, and particularly in urban areas, and I want to know what are we doing to build a bigger mobile capacity. And what I mean by that is to identify teams who are able to get in a vehicle and drive to places, drive to neighborhoods, drive to community institutions, so that they can get to those communities and vaccinate those folks in the neighborhood, because we still know that public transit is a problem. We still know that access to Wi-Fi is a problem. We still also know that oftentimes computer savvy and just the patience that's necessary to work through our registration process is difficult for some of our particularly elderly population. So I'm interested in knowing what we're doing to identify mobile resources and stand up teams that can go into neighborhoods and provide vaccinations. I think my dog wants to join into the conversation. Let's see. I also, as we look and see what's available and what our capacity is for mobile facilities, I want us to also remember the co-location that we've done, working through Title I schools, working with community centers, going to places where the community congregates, like churches and whatnot. I think it's a great idea working with Family Elder Care, Meals on Wheels, Community First. I think they go into neighborhoods and work with folks that don't necessarily come out to us. I just want to expand that to make sure that we are using strategies to get mobile facilities into neighborhoods or into zip code areas where we don't see a lot of participation yet.
Commissioner Trevelyan, the department has 4 mobile teams that are providing vaccines right now. And so those are the teams that have been doing, working with Housing Authority, going over to, Family Elder Care, et cetera. And so with that team, they transport in a van. And so the department currently has 2 mobile vans that we have outside of those vans. And so one of the things that we typically do in settings where, I'm going to use the example at the school. Typically, when we partner with the schools, we actually set up a location, and it depends on the vaccine that we have. We typically set up in a location inside and basically are a part of whatever type of activity they have going on. And so some of that could potentially be our mobile vaccine folks, but some of that is folks that are working at your Delco and your burger centers right now. And so basically, kind of transitioning some of the folks from their existing locations, whether it's Burger, Delco, and being at those sites like that. The apartment complexes that we are looking at right now have community centers. And so those particular community centers would be the clinical team that are able to do that. So the mobile teams in the van, they would be the ones that could go from, kind of location to location to location. One of the other strategies that we are working on is as we start to pivot, since everyone in the household is available for vaccines, starting to get an idea of how many folks are in the home outside of just, the person that's disabled or homebound. Trying to get an idea of the number of folks that are in the home as well. And so that is another strategy that we are going to use. One of the things that we have been able to do is as we have been going out to some of the homebound locations, folks that have caregivers, we have provided some vaccines to their caregivers as well. So it's just a matter of, as you all know, we are a hub, and so we typically, will set aside some vaccines so we are able to put them in our mobile locations, in our partnerships that we have on the weekends. And so the goal is for Austin Public Health to shift back to safety net. Once we are able to shift to safety net, as you all know, each weekend, we are providing a service for the next couple of weekends, but our goal is to be able to do more of those events where there are existing events, like, for example, the food event that happens on Thursdays at AISD, for example, the events where folks are starting to have events in the community. We're scheduled for an event in Dove Springs, for example. So doing more of that. Lastly, we do know that the portal is probably not the best thing for folks that don't have access to the internet. That is one of the reasons we set up the equity line back in January. One of the things 311 is assisting us to do is that if an individual would like to go ahead and sign up and have an account, they can call 311 Monday through Saturday, and 311 will create that account for them and get them set up. And then typically 311 will create a service request, send it over to the equity team, and the equity team will schedule them to come into, one of the locations. Or, if they are, right now we're still kind of really trying to focus on make sure elderly folks and homebound folks, if they are homebound, our mobile vaccine team will provide those vaccines.
Thank you for that. I appreciate your thoughtfulness. Last two ideas were, as we talk about 4 teams that are able to reach out into the community, just want to make sure that we approach that from the perspective of diversity, to make sure that we're addressing the languages and also some of those communities that aren't regularly reached out to. Because they're in quote unquote difficult parts of town. And there was, and we once, when I worked at Austin Energy, we tried to make a list of people that needed medical equipment so that we could reach out to them when there was a power outage or anything. Do we still have those types of lists, and are we able to reach out to the parts of the community where you have folks that have medical needs or medical issues that we are aware of that we can check on, almost a reverse 911, if you will?
Austin Energy still does have that list. I'm going to take that down as a note because we've not reached out to them, but that is something that I can reach out to Jackie Sargent and check in with her, because they do currently still have that list of folks that they are providing, working with them with their utilities because they're medically fragile individuals. So thank you. We'll do that.
Thank you for all the work that you all are doing. I appreciate you.
Thank you, Commissioner. And just one thing before I send it back over to City Council, I want to also thank Councilmember Fuentes for working with Del Valle ISD and the whole team that helped put together that clinic effort this past weekend, and with the students and everything. It really was just such great teamwork and a really good result. And I look forward to doing more of that in the future. With that, I will pass it over to you, Mayor, to ask any questions y'all want.
Judge Brown, thank you. And again, to the Commissioner's Court, thanks for letting us join you with this joint presentation. I want to again thank Dr. Escott as well and all the staff with Austin Public Health. In just a second, we're going to start. I think this time we start with District 10 and work our way back, but real fast. Director Hayden, the joint demographic information we have, sometimes you say it's the CODA site and sometimes you say community care. Is it just the community care CODA, or is it community care looking at them as one of our safety net providers?
It is all of the vaccines that are being provided at the Circuit of America, and it's information from community care.
So it's all the community care people, whether or not they're vaccinated at CODA?
Yes.
Okay. Appreciate that. There was a slide that you had that had the percent of total population fully vaccinated, and you had different countries, and you had 56% for the United States. Is that fully vaccinated, or is that a vaccine? I think it's page 29.
It's a single dose. It's a single dose.
Single dose. You might want to change the heading. You might want to change the heading on that if you publish that page. At one point when we were facing this, we had been saying to people, our limitation is the supply, and every vaccine we get, we're getting into people's arms. It now seems as if we're no longer in that place. And it appears as if we could get out a lot more vaccine if we had additional staffing or additional resources to be able to do that. Is that true?
So I'll go ahead and answer. Looks like Stephanie's frozen a bit. So this is what we anticipated. We talked about it last week. We went through this phase where we had people who were eager to get it, And so that passive model was okay because we had lots more people who wanted the vaccine than we had vaccine. But we anticipated that we would reach this plateau phase where we have lower numbers of individuals who want to drive across town to get it, as Commissioner Trevelyan said earlier, and we have to move the strategy closer to home so that it's easier, it's more convenient, and people don't have to work so hard to get it. And then we have to move into also the active model, where we're providing active outreach to people to encourage them to get the vaccine. So I think, the strategies that Director Hayden Howard mentioned is part of what.
Right. But my question is, if you had more resources, could you get out more vaccines? And then if you don't know the answer to that right now, then I would appreciate if you and Director Hayden would take a look at that. Given the changes in strategies, given the change now that we have more supply than we have capacity to get out, should we be taking a look at increasing the resources that are available for these new strategies in order to make it so that I don't know what the limitation is now. Since we have more vaccines than we need, and we still have people that aren't vaccinated, what do we need to do in order to be able to get there? I appreciate the strategies that we're doing, and I think they're great, and I'm great to see those. My question is, could we double or triple those efforts if we put more resources against them? That's my question. What can we do to increase the number of people now that are getting the vaccines, recognizing they're harder, recognizing the strategies need to change? And then...
Yeah, Mayor, I'll say, yes, more resources will help us to be more effective, but transitioning resources from larger sites to smaller sites are helpful also. But the smaller sites are less efficient. And that's going to require increased number of personnel to operate the different smaller sites around town. I will say that one of the other strategies that we have discussed is vaccines at EMS and fire stations. Still in the process of discussion, but we have EMS and fire stations in every community across the county that are staffed with people who can provide the vaccine. So that seems like a natural partnership, and we're close to the time where we need to start to transition to strategies like that as well.
And that's the question. And I think that sounds like really great ideas too. What I'm interested in knowing is, what is the barrier for us getting more vaccines in more people? And what would it take to overcome that barrier? Is it additional people to mix? Is it additional people to vaccinate? Is it sites? Is it whatever it is? I'd like to know what the barrier is, and then what the strategies would be to overcome those barriers. And then the last thing I'll say, and then I'll go to District 10 and Councilmember Alter. I think the list of things that Boston Public Health is doing that are equity focused are really good and really helpful. I'd appreciate it if there was a landing page on our website that was created that was called the equity page, that listed the kinds of things that we were doing, and so that people might be able to better find them. There were some things that Director Hayden spoke about that she's doing that I'm not sure people are going to hear the conversation we had today. But if there was just a page on that website that said, these are the equity efforts we're doing, and maybe there's a phone number attached to each one that said, if this looks like something that might fit for you, or you might have a location or whatever it is, so that there would be a place for people to go. So that landing page, that would equity efforts. And then the other one is, if you could come back to the council and to the commissioners and identify for us what the barriers are and what we would need to do to overcome those barriers to get more people vaccinated, especially the people that are hardest to get to, that are most vulnerable and most at risk. Thank you. Councilmember Alter.
Thank you. Can you hear me?
Yes.
Great. Thank you. I'm really excited that we are at this pivot point and that we can finally have conversations about how we really get more out into the community in this focused way, knowing that we have made a lot of progress. I want to underscore first, Dr. Escott's response in that we have a lot of resources that we can redeploy, and that was always the plan. And so I think that's part of the process here. Obviously, the question the mayor's asking is a very important one, but I think all along the plan has been to transition at a certain point, and I'm glad that we are at that point where we can focus on that transition. I don't see Director Hayden Howard on, but maybe Dr. Escott can answer the question I have. I wanted to get some clarification. I thought I had heard that Director Hayden Howard say that only 57% of our APH shots were going to Travis County. Do we know what is sort of Travis County plus Austin that's not in Travis County? Because that was a much lower percentage of the total than I would have expected, given what we had been hearing was going on in some of the surrounding communities. So if you could speak to that statistic. And then, as our interim health authority, if you could speak to, those of us who have school-age children who are being asked very adamantly to go back to school this week or next week, given changes to the Texas Education Agency's approach to funding our schools, how parents should be thinking about those decisions, and your advice, as an interim health authority. I know your kids and many kids in the area have been back for a while, but many in AISD in particular, and particularly at the older ages, have not. So if you could just provide some insights as a health authority for those of us who are making those decisions and whether or not our children are vaccinated, depending on the age. Thank you.
Sure, Councilmember. So the DSHS released some statistics on county by county, the percentage of individuals who are county residents who are vaccinated versus outside. And that's where that number came from. About 39% in the report that I saw of the Travis County vaccine doses were for people outside Travis County. The vast majority of them are Texans. And I think the take-home message is, we're not safe until Texas is safe. We're not safe until the U.S. is safe. We're not safe until the world is safe. But, we don't know what percentage of those went to Williamson County, Bastrop, Caldwell, part of our MSA. My guess is most of the excess went to our surrounding counties. But we do know that folks travel from Houston and Dallas and Killeen and El Paso and lots of other places to get vaccinated here. And I think that's, again, one of the things that we mentioned last week that I'll reiterate now. When we look at the zip code maps that are supplied from the DSHS data, those are residents vaccinated, not residents vaccinated by APH. Okay? And why is that important? Because we know people who are west of 35 have the resources, more likely to have the resources, more likely to travel distances to receive vaccine. And I can tell you, out in West Travis County, I know lots of people who drove a long way to get a vaccine early on. But we still have work to do. But again, part of the hub responsibility from APH was to provide vaccines to any Texan who signs up, and that's what we've done. My guess is, again, as vaccine becomes more available locally across the state, across the country, that our vaccination efforts will concentrate more on Travis County residents because people don't need to travel as much anymore. Regarding
But Austin if I could just interrupt but Austin covers more than Travis County, and so do we have any sense of, because there may be a lot of Austinites who are coming in to do APH, do we have a sense of that? Or the Austinites in Williamson County that have been?
I don't think we do. Okay. I think the data that DSHS has is just, were you vaccinated in your county residence or outside your county residence?
Okay. Okay.
But we can certainly ask and see. We have the zip code data for the individuals vaccinated by APH, so we can look at that. But it may be challenging because zip codes are, can transition across county lines and city lines as well. In response to what to do with your school children, I think it's an individual decision, and it's based on a lot of factors. Families who have someone at home who is at high risk for severe disease should be more cautious about sending their children to school in person. If those individuals are fully vaccinated, that risk goes down, and they may reconsider sending their child in person now that they are themselves protected. I think regardless, all of our Travis County school districts have continued the masking and distancing guidelines. They're continuing to have hand washing stations, hand sanitizer. They've got protocols in place, and they're very good at it. And again, I want to reiterate that the clusters of cases that we're seeing in schools are almost always related to athletics, band, cheerleading, extracurricular activities. We are not seeing transmission in the classroom. We have good data now that says 3 feet plus masking in classrooms is very protective. We're seeing these clusters when those things aren't happening. We're seeing them on chartered buses and in practices. We're seeing clusters in choir. The things that we've been seeing, where we've been seeing them all along, is where we're still seeing them. So I think if you have a child who's going to wear a mask, follow the guidelines, that going to class in person is fine. And my children are going in person. Mayor, you're muted.
Thank you. Councilmember Tovo. You're muted. Can't hear you, Kathy.
Now?
Yes.
Okay, I think my earphones aren't working. My questions are going to follow up on Councilmember Alter's, because that's what's on my mind today too, not just as a council member, but as a parent. I also am getting kind of the almost daily requests to send my kids back. And so I just want to stop and say I really appreciate the work that our public health has done with our school district, and I appreciate all the precautions our school districts have taken and to keep their student populations as safe as possible. I really think the state's decision to put such pressure on schools to increase their attendance here in these last 6 weeks is outrageous and inappropriate, and is just should not be happening. And I appreciate and I understand why we're all getting so many messages encouraging us to send our students back to school. And I just really regret that AISD and all of the other school districts throughout the state are now being placed under such pressure. So Dr. Escott, again, I understand you've been working with the school districts and that our school districts are doing what they can do. I also know what we all read in the paper yesterday or on one of the TV stations, that probably as a result of one of the clusters you mentioned that started in an extracurricular activity, students who went in for the state required testing, which has to be done in person, were exposed as a result. And so, as a parent who is now going to make an uncomfortable decision to send my students in, though they've been home all year because they have those state required tests, I guess I'd like to understand how you are working with school districts on those testing areas themselves. Is it being suggested that those be within 3 feet? Or are they using the older guidance of 6 feet? And I guess in particular, I don't know how much information you could give us about those scenarios where students were exposed, but if individuals on those transportation using buses to get to away games are wearing masks. Do you have any sense of how the transmission is happening? You know, in looking at the instances where there is transmission, despite all of these great precautions, what's going on? Is it that the precautions aren't being taken in these instances? Or is there something else that we're not understanding about that?
So, Councilmember, you know, I don't have the details, nor can I share the details of those investigations, but I'll say some things in general. In general, you know, students exposed in a classroom space have close to zero risk of transmission if they were masked and appropriately distanced. Yes, they still need to be quarantined, but no, they're not likely to go on to develop disease. You know, again, the risk is almost always associated with face-to-face encounters without masks on. So that's where we're going to see transmission. I don't have the specific information about the bus travel, but my guess is that, you know, a bunch of teenagers on a chartered bus driving a long way are probably not going to keep their masks on the entire time. Plus, you have the other issue of confined space for long duration of time, right, which certainly increases the risk. In those kind of settings, you know, again, we encourage school districts to mask, to have smaller numbers of individuals on the buses spaced out. But, you know, for those kind of long duration trips, for air travel, people should strongly consider higher level of protection, including double masking or N95 masks, because of that increased risk due to the duration and close proximity to others.
Dr. Escott, you said, you know, you might consider whether your child will wear a mask, but it really depends on whether the students around your student will wear their masks too, right? I mean, if you're wearing an N95, then you are providing some level of protection for yourself. But if you're, I mean, all along, we've also heard that if you're wearing a mask, you're really protecting others. So to some extent, it's not just about whether your student is going to wear a mask and keep it on. It's really about whether the other students around your student are also going to keep theirs on, and if not, whether there'll be, you know, appropriate reminders to put their mask back on. Is that accurate?
That is accurate, Councilmember, and that's precisely why we've maintained the mask mandate in the health authority rules. You know, what we've seen, and, you know, my children have friends in other parts of the state that have taken away the mandate, you know, schools that have made the mask optional. Optional generally equals nobody's masking. Yeah. Because there is that peer pressure. Well, I don't want to be the only one wearing a mask in my school. You know, I don't want to be the person who's afraid. And that's why it's important for now to continue those things in our schools, on our buses, in our public spaces, any, you know, places outside the home, so that we can continue to push down disease. People are still dying from COVID-19. People are still being hospitalized every day. People are being intubated, put on ventilators every day in this state, every day in this country from COVID-19. We are not done yet. And we've got to continue those protections if we're going to, you know, try to get to herd immunity quickly. Part of herd immunity is a mobile number. The more disease burden that we have, the more people we're going to have to vaccinate to suppress transmission. If we maintain low numbers, if we push it down further, the number that we need to reach herd immunity goes down. And that's the point we've been trying to make for the past couple of months, is it's a mistake to declare success, to declare victory too early, because it prolongs the time it takes to reach that herd immunity. So somewhere between 60, 70% and 90% is where we're going to hit herd immunity, where we no longer see the clusters happening. But we can all contribute to trying to get it towards the lower end of that scale by suppressing transmission now and beating COVID-19.
I appreciate it. Thank you.
You were on mute, but I think I can go.
It's you.
I would like to know more about the cross-county reporting. It sounded like you send the information directly to the state. So it's not necessarily that you're letting other counties know that we have vaccinated someone from their county and vice versa. It's all going to the state, and do they have access to your data to appropriately assign zip codes? Can you tell me a little bit more about how that reporting happens?
So all providers in Texas are required to enter their data into a system called MTrack2, which documents where they reside, where they report their residences, zip code, and what county they were vaccinated in. So what the state has done is, match up how many people had a zip code in Travis County, how many people were vaccinated by Travis County, within Travis County. So there's in county versus out of county. You saw there were tens of thousands of people who were vaccinated from out of state, a few thousand from vaccinated from outside the country. The data is a bit nuanced because, it's often the data that you have on your driver's license. So if you originally moved from California and haven't changed your driver's license, it may show that you live in California, but you actually live in Travis County. So it's not concrete data, but it does give us an idea of the movement of vaccine and people to get vaccinated.
Okay, that's really helpful. And I believe that Representative Donna Howard is doing some work on the MTrack system at the legislature. So I just seeing what comes of that too.
That's great to hear, Council Member. I will say again, information systems in public health have been a struggle for the past year. And it's a reminder that we have to make substantial investments in public health infrastructure across this country, and certainly in Texas. We're suffering from 40 years of decreasing funding, and we're paying for it now. So we have to learn a lesson. We have to shore up the infrastructure. We have to spend money, and the result will pay off in dividends. The struggles we're seeing in East Austin right now are not surprising to us. And that's a problem. We've known about the issues for decades, but we haven't changed the infrastructure to make significant progress there. The reason we're struggling in East Austin is because we always struggle in East Austin, because there is no healthcare infrastructure, because there aren't healthcare providers, because people don't have access to pharmacies and doctors' offices and community health workers to the same extent that they do west of I-35. We can't fix that overnight, but we can fix it. We just have to make the commitment, the long-term commitment, to make that change.
I completely agree. These systems need to be worked on to make sure that when we really need them, they're in place and deployed.
Okay. Councilor Poole.
Thanks, and I don't have any new questions. Covered the information really nicely, and my appreciation, as always, extended to all of our staff who are working on these issues so diligently. Thank you.
Councilmember Kelly is not with us today. That gets us, I think, to Councilmember Kitchen.
Yes, thank you very much. I appreciate this information. I particularly appreciate the development of the dashboards and the continued effort to have that information very accessible for people. So I have a question about, this is for Dr. Escott, and particularly for Director Hayden Howard, or maybe if she's still with us, but my question relates to our goals. I think I heard you say, Dr. Escott, that our goal was 67% vaccination rate, and right now we're somewhere around 49%. The reason I'm asking this is I'm wanting to understand if have we actually set a goal, and can we do that in a way that people can track towards? I think it really helps our community to understand what number we're trying to hit from a vaccination standpoint. I know there's a lot of complexities to that, but I think it is helpful. I know I've seen on the national level, it's been helpful for people to see the kinds of goals that our president has been setting for us. So my question to you is that 67%, I understand we're trying to reach a range to get towards herd immunity, but are we stating that as a community goal? And can we state a community goal and then track towards it?
Council member, the challenge is the goalposts move. 67% is the predicted minimum that we need. It may be 90%.
Okay.
Where that goalpost is depends upon the spread of disease. I think our goal should be 0 cases, or very close to 0, because when we stop seeing the clusters, when we stop seeing community spread, when we start being able to say, I know where this case came from every time, that's our goal. That's herd immunity. We don't know if it's 67% or 70 or 80 or 85% or 90%. We'll only know when we get there. But, I think the goal for now is as many people as quickly as possible.
Well, Dr. Escott, I appreciate that, but I don't think that's as helpful for our community, because it's pretty hard for our community to track as many people as soon as possible. I understand what you're saying, and I think that that's really important messaging to get across. But I also think it's important for our community to be able to see some progress and track against it. So my question really to you and to Director Hayden Howard is if you can give us some I understand the complexities of it, but we've done it. Setting our stages has been one way that we've done it. We've done it in other ways also. I would really like to ask you all to set some goals for us, because I think that that's really important, and then help us track against it every week. I've seen you all start to present that kind of information, which I really, really appreciate in the presentations that you've been making in the last few weeks about the level of vaccinations, and that's helpful. But I think it really is best if we can do that in relationship to some kind of goal. I don't know if Director Hayden Howard, if you want to speak to that or not, or maybe this just you and Dr. S can spend some time thinking about this. Yes.
So I'm going to apologize. I'm having some internet problems here at campus. But I will tell you that the 67% is in our plan. It's in the plan that we put together. And so that is what we are tracking off of right now, kind of based upon the 400,000 folks that have at least received 1 dose. But as Dr. Escott has said, that is the minimum. And so that is a starting place for us. And so when we bring back the data every week, we will be tracking towards that 853, 549. Now, over time, we know that does need to change to move us to the place, where we're safest. But right now, we're going to stick with the 67%.
Okay. I would just ask if you could make that clearer on the website with the vaccine dashboard information that we have. You may have it there, but it doesn't stand out real clear for people. And so some kind of visual to track against it, again, with the caveat that it's a minimum, I think would really be helpful for people. I think our community has done so well when we've pushed the messaging and challenged our community to keep each other safe by wearing masks. I think it helps our community to have that type of goal also about helping to get people vaccinated, so that our community members can help us too by identifying their friends and family and neighbors who haven't vaccinated and can help us get closer to that goal. So I would ask you all to consider that.
Okay, thank you. Councilmember Kassar.
Thanks, Mayor. I want to take us back to the point and the questions that I think the mayor and some others were asking. It was only a few work sessions ago that we talked about how the continued limiting factor for us was supply of vaccines. And now that that is shifting, it seems like there's demand, a demand issue on the website yesterday, and demand in general, as you mentioned, Dr. Escott, and then 2, staff capacity. And I want y'all to tell me, I want to lay out sort of my thinking on those 2 issues and then hear where I might be off. But on demand, even though, of course, some number of really eager folks have found a way to get the vaccine, my sense in the community is that there's still a really significant amount of demand, and that there's reason why a lot of people maybe have given up on checking the website, because so often you were at the end of the line or you couldn't get an appointment. But now that there are open appointments and now that there is no wait, I wonder whether we could actually pull up some demand if we can really get the word out to people that we know that this was frustrating in the past. We know this maybe didn't work for you in the past, but there really are appointments now, because my sense in the community is that there are people who would still want to sign up, but they assume that the website is going to be jammed, and that there aren't appointments. And that on the demand side, I also believe that getting off of the website, providing more of these vaccines to people that don't have to sign up through the website, that means community walk-ups and showing up at community events and letting people just get the vaccine then and there, that there is really significant demand from people who just may not, that going through the whole website navigation process may not be for them. And so I want to hear from y'all whether your thoughts differ any there on the question of demand being a limiting factor now that we have more supply. And then the second part on staff capacity, I think this might be more of a message just also to the manager, that I have already started to see places where it seems like we need more staff capacity to get vaccines into arms. Now that there is more supply, I'm starting to hear from more people saying, hey, maybe we can get more vaccines to places in zip codes and places in my district that have been hardest hit but have had least vaccines. But frankly, we've struggled sometimes to find the staff to put the shot in people's arms. And we cannot be the limiting factor on the staff capacity side because we don't want to turn away a single dose. And every dollar I feel that we put into vaccines is the best investment we can make, because it prevents a business closure, it prevents hospitalization, it prevents unemployment, it prevents us having to spend more on the eviction diversion programs. And so if we're at a place where there's increasing supply availability, I would really and I think our council has put it as its top priority, that of any of the spending we're going to do, the first thing we need to do is make sure that we're leading the state in how quickly we can get vaccines out and draw vaccines down. So it sounds like that's what I was hearing from Dr. Escott and you, Director Hayden Howard, but now it's just an important pivot moment where we've been struggling so much with supply for so long, it sounds like, up until just the last few days. And now it sounds like we need to better fill slots, set up walk-ups, set up the EMS and fire stations, and then really ramp up the number of people who can actually help put the shot in people's arms.
I'll start. I think one of the things that just kind of want to paint a picture for you. When things were not as open as they are right now, we, through the medical society, we had, thousands of volunteers. And so we have folks that fit into the category of volunteers. We have staff that are on Austin Public Health, City of Austin's payroll, and we have contracts with vendors that are sending staffing to fit into those positions. And then lastly, we have a contract with a nonprofit provider that's able to provide those vaccines. And so the department typically will pull kind of from those instances, and I will include the fire personnel We have the fire personnel that are assisting us, as well as some folks that are retired fire officers. And so, I think one of the things that, we're looking into adding a couple of more contracts with vendors that can provide the vaccines. I had a meeting yesterday with the Hispanic Physician Association. Right now, we are working with the African American Physician Association as well. And so, but all of that falls up under folks that are now going back to work, have their ability to be in the space, they're fully vaccinated. So you don't have as many folks that can provide the vaccines that you need. And so, for example, for us this weekend, we will not be potentially, we may not be at Burger on Friday and Saturday, because we're going to shift those operations to go to Sacred Heart this weekend, because that's one of our commitments we've made. We know it's a need in the community. And so that is one of the reasons why the collaboration between the partners is going to be essential when we come up with this map. Because if we're able to say, APH are here, and then the various partners, UT, Dell Health, Lone Star, et cetera, kind of understanding where they are and how they are able to provide those vaccines. And so that is the strategy that we are working towards to, one, kind of beef up what we have, but knowing that using of volunteers has been helpful for us, but then also looking at where our partners can be, because it's going to be a combination of that. I think at this point, if you provide a vaccine, if you're able to have that skill set, and especially if you're a contractor, you're going to most likely go where you're going to receive the biggest benefit for you as an individual. So it is definitely some competition in that light. The other thing that I shared earlier today is that the ability to train folks to be able to provide vaccines that may not were providing vaccines in the past. That's not something that they were able to do. So we're looking at a lot of different instances kind of at once of how, we'll be able to reach the goals that we have to provide the vaccines to the communities that need it the most.
Thank you. And I just think that the idea of having them, for example, at fire and EMS stations where you can just walk up also makes a lot of sense to me. And this is one last moment for a PSA for anybody listening, that obviously we do need that help, and that there are really hard hit zip codes in the Eastern Crescent where we have potentially vaccine availability and people, but we need help getting those vaccines into arms. So anybody listening, please do shoot Austin Public Health and some of our offices a note if you have volunteer or even staff capacity that can help us, while hopefully our Austin Public Health team really ramps up that staffing capacity that we need. So thank you.
Thank you. Councilmember Renteria.
Thank you, Mayor. My question goes to Dr. Stephanie Hayden Howard. How are we handling, are you having success on vaccinating the population? What kind of plan is it out there that y'all are using to do outreach to get these people vaccinated?
So there are several things that we are doing. We have 7 contractors that are out there doing outreach for us in the community. Several of the partners are even going door to door. So in our conversations, the folks that have the contract with that are doing the outreach and communication. However, there are other partners that are referring to us and that basically have been referring to us since January. And so those referrals are going to the equity line, and our staff are making those outbound calls. definitely like to, acknowledge the county because their county staff are continuing to help us with that call center as well. And so reaching out that way. We're also definitely reaching out, via an agency if a person is working with an agency. But then we've also kind of shared that, if folks are in need of a vaccine, we're just asking them to call 311. If they want to set up that account, they will be able to set that account up with them. And then our staff will call them back and schedule an appointment. And so we're looking at kind of all of those different efforts to be able to reach the hard-hit communities.
Well, thank you for that. Is the Johnson & Johnson vaccine, is that going to hurt us when we're giving out the one shots to the homeless population?
So right now, as Dr. Escott shared earlier, we are discontinuing that use of that. Last week, we received about 1,000 doses of that. And so that has been, we've stopped using that. Some of our homeless population has been receiving the Moderna as well, especially those that are in the protective lodges and in those settings where folks can go back and provide that second vaccine. So it has been a combination of both.
Thank you for that information.
Councilmember Fuentes.
Thank you. Thank you for today's presentation. I especially appreciated the pie chart on reaching herd immunity. Found that very helpful. And from that information, we learned that about 46% of our community are classified as vulnerable. They have not received the vaccine, and that we need to ensure that they have information to get the vaccine. And looking at that number coupled with the other announcement regarding our online scheduling system, where we learned that we had 14,000 appointments available and only 3,400 of them were booked, we can clearly see that our online scheduling system is not working. And just as I reflect on today's conversation, I'm also noticing that a lot of what we're doing is wonderful and great, but it's from the approach that it's on the individual to come to us. So they have to hear about our equity line. They have to go to our online system. And I think, with this pandemic, it's on us to be iterative throughout the process. And I really would like us to move to a more neighborhood model approach where we go into neighborhoods, get off of the online system, go offline and reduce that barrier. I think that neighborhood approach is absolutely needed. And we owe it to ourselves to really lean into that strategy so that we can glean best practices from it. And, I know that part of the resolution that Austin City Council passed just a few weeks ago regarding COVID assistance, part of what we outlined was around a mobile vaccine program. And I'm heartened to hear that we have 4 vans within APH that we can deploy for a mobile vaccine program. But I also want to share that I just don't think that's enough. We have at least 11 zip codes in our area that do not have a single provider. And so we really need to be mobilizing hand in hand with the community. Our community organizations are trusted partners that can be the messengers and the advocates and the vaccine navigators to go into those neighborhoods and to let folks know where to go for their vaccine. And so I just wanted to kind of share that I hope that we go to a more neighborhood approach model. I think that outreach is needed, and part of that infrastructure, Dr. Escott, that you outlined so eloquently earlier, that is lacking in the Eastern Crescent, also gives me even more motivation to say that I think we should be investing in human infrastructure and working and partnering and investing in nonprofits who are already doing the work, who are ready and able to assist Austin Public Health and the county in being vaccine navigators, in getting this information out to the community. We really need to shift the approach and meet our community where our community resides versus having them, figure out our website or figure out our phone call, our equity line. So I guess my question is, if you could talk us through how are we at this point in week 17 of the vaccine distribution strategy, what is our marketing plan look like? How are we getting the word out about how to get a vaccine? And I know that we know we're working with certain organizations, but do we have budget allocated to partner with trusted organizations to be the messengers, to be those vaccine navigators, to go out into the community? What does that look like? Is that part of the plan?
That is a part of the plan. We have 7 contracts in place with partners that are currently doing the outreach, and they are going door to door. They're working with folks that have currently been provided services through them before, but they're also going door to door to get that information out to us. In addition to that, we have several task forces that are continuing to meet. We have a faith-based task force. We have a Hispanic Latinx task force that met last night. We have an African American task force and an Asian task force. And so all of those are meeting. They are making recommendations into our vaccine leadership team. And so our staff are, we're working in a lot of places. We have several contracts that are designed to do the outreach and to be out there to get the information to funnel it in. So, for example, one of the vendors is providing information to us for the Southeast Branch Library to be able to, because we've shifted that site. And so that particular location is working with folks in the 404 and the 401 neighboring communities as well. What folks have been doing for us thus far is that they have been referring folks in. And so, but some of the folks that they did not refer in because they did not meet the definition at the time. But with the transition as of Monday, we'll be able to see more referrals from the grassroots organizations that will be able to refer more people to us because of being 18 years of age and older. And so, so that is definitely good news. That was one of the reasons why we made the transition to go ahead and open things up. In addition to that, we need to also continue to have those conversations with employers. Being able to, last night at our meeting, we kind of refined some of the areas of where that task force really feels like the city needs to continue to focus on. And so that does pick up folks that are 18 years of age and older that are working in those industries. And so that is going to be important for us as we pivot. Those groups have also been able to provide recommendations for us of potential partnerships of kind of where we should be. So, for example, Sacred Heart were there this weekend, and that's based upon the recommendation, and partnership from that community. And we know even within that community, that's about 17,000 folks that have the potential to be referred to us that can come into that site, but also can come into our other locations. I understand your concern about us only having 4 teams. However, I don't want you to focus on the 4 team. I want you to focus on the total amount of folks in Austin Public Health. Because even with our teams, when they're out doing their work, that is a different set of folks that are at Sacred Heart. So we're able to stand up those teams, and those mobile teams are still working in those various locations, whether it's housing authority, et cetera. And then we're having those clinical operations. So it has to be a blended approach where folks are able to come. One of the things we've noticed with the Sacred Heart event is it basically the U.S. construction folks did the recruitment through the church, et cetera. And so basically it's a walk up. They give them kind of the time frame. We work together on the hours, and then folks just walk into those operations. They do the paperwork when they get there and work their way through. And so most of the operations, we're knowing that that is something that we're going to need to do as well. So kind of throughout this process, a hybrid is going to be important for us to meet people, where they are, to be able to provide those services. So, as we move along and have, more information, we'll definitely bring it forward to this group and start providing more information about that in our slides.
Thank you, Director Hayden-Howard. Just a clarifying question. The contracts that we have with those 7 organizations around the vaccines, is that to register folks for the vaccines, or is that to build trust around the efficacy of getting a vaccine?
Yes, it's not for the registration. It is for outreach and education. And so yes, so folks that may be hesitant, they're able to, kind of talk with them, do the outreach, and then connect them in to us so we could take it from there to get them scheduled for the actual appointment.
Okay, so at this point, do we have any contracts with any organization to do vaccine navigation, helping folks get registered for the vaccine?
No, we don't have any contracts with individuals that are helping with registration.
Okay. Yeah, I just is a key element in this is really, investing in that systemic approach to organizations who know their community the best and being able to do that level of outreach, because, they are the trusted messengers. Oftentimes when people know that government is involved, they don't necessarily have a positive experience with it, but they know that it's their local group. If they can recognize the face that's there, telling them about the vaccine and how to get registered, it really makes a difference. And so I just want to reiterate, I think we really need to move to a neighborhood approach model. I love the steps that we're taking. We're obviously very clearly making progress toward it. Yeah, that's it. Thank you.
Thank you. And I think, part of the answer, just a part of it, to Councilor Fuentes' question goes back to what I asked earlier about creating a page or someplace where people can see what it is that you're doing. Because I think you're doing a lot of things that people don't see, but also people don't know how to access the things that you are doing if they or their support groups, or their family or their friends can help them. So creating that place to be able to have that, I think, would be real helpful. That gets us to the Mayor Pro Tem.
Thank you, Mayor. I appreciate it. I think the beauty of being able to go last in this situation is that I've had the opportunity to have really brilliant colleagues, both at the county and here for the city of Austin, ask all the good questions. And so I really feel like in a lot of ways, most of my questions have been answered, especially in response to Commissioner Trevelyan and now in response to Councilmember Fuentes. I share her concerns. I also recognize, though, that there's probably some distinct level of difficulty to be able to establish efficacy when it's small scale application like that. So for example, I personally I had the opportunity to sort of follow a member of our community, one of my constituents who is helping on his own time, who's helping folks find vaccines and helping them get scheduled. And I just got to tell you, the level of effort, the amount of man hours that would go into walking our communities, neighborhood by neighborhood, street by street, apartment complex by apartment complex, would just be astronomical. And so I'm curious to see, what does it look like, the practical application of what Councilmember Fuentes is suggesting? What does that actually look like in terms of man hours, cost, expense, efficacy? I mean, at the end of the day, if it's productive, then it's obviously worth it. But is it productive is the question that I would be leaning towards getting answered. And then, so my only question at this point is, I saw that the one group where there looked to me, I know it was only a couple of percentage points, but it looked to me to be the most substantial in terms of increase was with our Asian community. And I'm curious if Director Hayden-Howard or Dr. Escott, if y'all have any indication as to why that increase in the Asian community? And then as an extension of that question, just wondering if there's anything that we can do, our offices can do with our spheres of influence to encourage more people. I mean, aside from obviously, you know, the closer we get to herd immunity, the better off we all are. But is there something specific that we can do in our spheres to help push people towards getting the information that they need and ultimately being vaccinated?
Well, Councilman Ross said the change in the Asian American community, we don't have a clear reason for why there was such a big jump. I will say that, you know, with the data for the immediate previous week, there's going to be some changes in that as new data comes online. Relatively low numbers of individual tested means that we may see larger variations in some of the data. So that certainly may have an impact. I will say that our Asian American community probably has a higher vaccination rate than any other community of color. They are overrepresented by vaccinations as compared to their representation in the community. So that community is doing very well. But having said that, we still need to continue that outreach effort until we have 0 cases. So that's going to take time. That's going to take effort. But it is, you know, as you have just suggested, with moving away from large vaccination centers, the efficiency is going to decrease. Return on investment is going to decrease. And that's why it makes sense for us to identify where those resources already are. You know, as has been mentioned, we've got community groups out there that are capable of delivering vaccine. We have our EMS and fire stations who are already mobile, already vaccinated. For every fire apparatus, there are 4 vaccinators on every truck. We have people, we have the resource, we have the physical space, we have the vaccine. If we bring those things together and partner them in areas where we already have the resources, then it gets a lot more efficient.
I appreciate that. I think the other half of that question was for Director Hayden Howard, who appears to be off again.
I'm here. I'm going to leave my camera off for now. So when you're looking at neighborhoods and kind of looking at how you would develop a neighborhood model, one of the things that is definitely important is that you must definitely prioritize. And so, you know, by looking at the data, we've started the location at the Southeast Branch Library because we do have a couple of partners that are in that community right now that are going, that have gone door to door, that are referring folks to us for that site. And one of the things, you know, that they've shared with us is that they would rather just kind of create like a Google document and provide the name, the phone number, and the best time for us to contact the folks to schedule them. And so that is the process that, you know, that we've done and have implemented. So right now, that is working pretty well. We've only been doing it for a couple of weeks. And so we would definitely want to be able to look at other communities. The department, as well as our partners, have community health workers, you know, on our payroll, and then we contract out with partners to provide those services. And so being able to add those additional folks, that is something, you know, door to door is a proven model. You know, it's been around for a long time. Most folks, you know, kind of shy away from it, but it is a proven model. And we're definitely at that point. I think, one of the other things that, from a cost perspective, I think that, again, you go back to prioritizing and being able to identify, kind of where you would want to be. And then as we continue to map that information, on a map to be able to show how we are increasing with vaccines in those communities. And so that will kind of, give you the response of, is it going to be, feasible economically to do that as well? But it's a tried model, as I stated earlier.
I appreciate that. I really do wish that there wasn't so much of a sense of urgency. I do feel like we're missing some opportunities just because there is so much that's urgent about this. And I guess nobody can control that though. Thank you. I appreciate it.
Great. I think those are all the questions, Judge. We've gone through the council.
Thanks. Director Hayden Howard, are you still on? I just had one clarifying thing. If you're outside of the city limits, I think there's like a geolocating thing that doesn't let you call 311. Do you know, is it 974-2000?
Yes, that is the number, 512-974-2000.
Okay, great, thanks.
Mm-hmm.
All right, so I think those are all of our questions too, Mayor. So let's see, we will go ahead and we're gonna, in a moment, adjourn, and we'll give a 5-minute break and come back, I guess, at 11:25. And then I will pass it over to you, Mayor.
Okay, we're going to go ahead at 11:18 and adjourn the Austin City Council joint meeting today. Thanks again for letting us participate with you. Our meeting is adjourned.
Everyone, stay safe.
Thanks, everyone.
while putting some new strings on my old guitar. I know just what I'm gonna do. I'm gonna sit down and write me a song, and I'm gonna give it to you. I realize now, after all those hard times, and Lord knows we've had us a few, together forever, wherever we are. I couldn't be me without you. I couldn't be me without you. I couldn't be me without you. Together forever, wherever we are. I couldn't be me without you.
I found my mind where I left it, a little bit dusty, but it was well rested. I found my heart stripped and broken, a little unsettled, but it was well spoken. It said, "Sir, a little more care next time, a little more care next time. Calm that trigger finger down, put your hands up, throw the gun on the ground." I found my guts spilled like milk. I cried for days, but it was no use. I touched my lip and it was bleeding. I must have bit hard, it went right through, saying, "A little more care next time, a little more care next time. Stick that wagon, turn back in. Please look away from the mannequin." I found my phone saying no more. The room was spinning, so I slept on the floor. I found my knees, decades older than the rest of me. After the war, saying, "Yeah, a little more care next time, a little more care next time. Strike a match and throw it in. Please look away from the flames." Flying faster as if they knew what they were after. Found my little piggies grinning, wiggling like 10 happy children. A little more care this time, a little more care this time. Plant those feet into the ground, lift your head, take a look around.
the day.